Hi, Assalamualaikum everyone. Today we are going to present the risk assessment in the impact of coronavirus disease 2019. My name is Nofairuz Sahira and I will be covered the health risk. Along with my groupmate, Nadira and Khalida, we explain the economic risk. And education risk will be covered by Fazana and Sakina. Before that, we will get into the introduction.
We will present about the risk assessment. What is risk assessment? Risk assessment is the process of identifying, analyzing, and controlling hazards and risks. It is performed by a competent person to determine which measures are or should be in place to eliminate or control the risk in the workplace or in any potential situation. As a result, identifying hazards through the risk assessment process is a critical component in ensuring the health and safety of employees, customers, or others. Thus, this video will explain the risk assessment of coronavirus disease.
Risk assessment on the impact of coronavirus disease. The coronavirus disease will affect the health risk. The objective is to prevent the coronavirus disease. The period is the COVID-19 or the coronavirus. Coronavirus disease is an infectious disease caused by SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Coronavirus are a group of related viruses that cause disease in mammal and bird. In human, coronavirus cause respiratory tract infection that can range from milk to leather. There are two types in hazard. The first one is the physical hazard, physical interaction outside the world and people. The risk of breathing this in is highest when the people are in the close proximity, but they can be inhaled over the long distance, particularly indoor. Transmission can also occur if splashed or sprayed with contaminated fluids in the eyes, nose, or mouth, and rarely via contaminated surfaces. The second one is the moral hazard. People who get disease, the COVID-19, and do not follow the SOP. A character defect in an individual that increase the chance of loss. The next one is loss. Medical loss because not all insurance will be cover the COVID-19 expenses. Furthermore, loss can be in the income also. This is because of unemployment and cannot be covered if any health occur. These are the 5 steps of the risk management process. The first one is you have to identify existing and potential risks. Health can be affected from the coronavirus disease. The lungs are the organs most affected by the COVID-19. Income fund can also be defect. During the coronavirus occur, many people stay at home and cannot go to the work because of the social distancing. The second one is evaluating potential risk. Frequency risk occurrence. Before the antidote founded, many people face the risk and also a lot of people die because of the coronavirus. Severity is the impact of risk. The risk is the coronavirus disease. The third one is examining alternative risk management technique. Low frequency with the low severity is the low of income. Low frequency with the high severity is the financial problem. High frequency with the low severity is the health risk. High frequency with the high severity is the health risk. The fourth one is select and implement risk management program. Risk avoidance. The temporary physical closure to go outside because of the coronavirus. Following the SOP, wear a mask, social distance, and always sanitize your hand can avoid the coronavirus. Loss prevention. To reduce the health risk and should stay at home. When people stay at home, this can avoid the coronavirus disease. Last but not least, evaluating, reviewing, and controlling the risk management program. To ensure the techniques are suitable and satisfy the current situation. Since we are impacted the coronavirus, the government should think what's best for the society to avoid the coronavirus disease. If not, we have to do new techniques that is suitable to control the risk. The next step is to find a new antidote so that we can control the risk. Do not use the same technique that is not suitable to control the risk.
Next one is economic risk. The objective of economic risk is to reduce the impact of economic recession during COVID-19, and the peril is economic recession. A recession is a serious decline in economic activity that lasts longer than a few months. It is measured by drop in these 5 economic indicators such as GDP, income, employment, manufacturing, and retail sales.
So for hazard, it divided into 2, which are physical and moral. For physical, it caused to the devaluation of the Malaysian ringgit and the decline in the country's gross domestic product. With China as our country's leading trading partner, Malaysia's economy was directly impacted, and the economist has cautioned that the pandemic could hit the GDP. The implication of our political crisis and the outbreak has weakened our Malaysian ringgit. Next, for moral, it is from poor economic assistance from the government. The government need more effort in order to reduce the unemployment rate and increase the income level. Right now, minimum monthly wage in our country is 1,050 ringgit Malaysia, and the government need to raise the amount since the prices of goods are increasing as well. The last risk assessment on the impact of COVID-19 is loss. Due to this COVID-19 outbreak, it leads to declining in real income, and our country have higher unemployment rate. The recession has compounded employment and income difficulties for younger generation. The latest data from Department of Statistics Malaysia showed that the unemployment rate rose by 4.8% from 4.5%. So, for the existing risk, stock on Malaysia's stock exchange of Bursa Malaysia plunged during the outbreak as the investors sold the securities due to projected economic influence caused by the virus. The amount of stock return that received by the investor also decreasing. Moreover, we can also see some changes in investment trends at the US, whereby the trends also declining, and it automatically influenced Malaysia's stock. Therefore, the movement in the stock market has received a lot of attention. The decline in the demand among the domestic consumers reveals a huge impact towards the whole Malaysian market, such as KLCI for REITs, construction, technologies, communication, property, plantation, financial services, and many more. The country's economy was directly impacted and hit the country's gross domestic product. Next, for potential risks, it has the possibility that will change the macroeconomic conditions such as inflation, changes in foreign exchange rate, and political stability. The next risk management process is evaluating potential risks. For frequency, according to Malaymail 2022, the headline of inflation is projected to average between 2.2% to 3.2% in 2022. Besides, due to COVID-19 and to restore the economic condition in our country, Bank Negara Malaysia has to increase the OPR rate from 1.75% to 2.25%. Meanwhile, for severity, based on the statistic that has been shown by Berita Awani, due to financial problem during COVID-19, the suicide cases were increasing up to 58.9%. In 2019, the number of the cases was 609. Meanwhile, for 2022, the number of cases was increased to 631. The next process is examining alternative of the risk management technique. Due to the pandemic, a lot of people lost their income as the government has to implement movement control order in order to avert the virus from spreading. A lot of employers have to fire their employees in order to reduce the cost. In this case, the number of household debt are increased because they have no income to make a payment. For high frequency, if the cases keep soaring day by day, the government has no choice but to shut down all industries that contribute revenues towards our economy in order to avoid any losses of life, because we all know a lot of positive cases comes from factories.
The fourth risk management process is select and implement risk management program. There are 2 categories. Firstly, loss prevention. You can apply physical or social distancing. Second, quarantine. And third, keeping an eye on your investment and paying attention to changes in government policy and business practices, as well as your own spending habits, so that you can minimize your exposure to economic risk. The second category is risk avoidance. You can obey MCO and SOP rules in order to avoid having a cluster, minimize social events, include cultural and sport events, and various types of social meetings, such as working in office, participating in classes at school, shopping in supermarkets, and many more. The last risk management process is evaluating, reviewing, and controlling risk management program. The first one, continuous following the risk management program. Second, review the effectiveness of risk management program with recent development of COVID-19. And lastly, government can look at the feedback from people in the country and other countries regarding the specific initiative and economic assistance that was given.
The following category affected by COVID-19 is education risk. These risks concern impact COVID-19 at school and higher institutions. The objective of the risk assessment in education is to prevent the disease or virus COVID-19 in schools or high institutions, as it is easily spread to others. Thus, the peril of the education risk among students is because of the outbreak of COVID-19 that spread over the world. Hazard is divided into two, which are physical hazards and moral hazards. For the physical hazard, the hazard from physical interaction, such as students' close contact with friends, teachers, and staff, can affect themselves with the disease of COVID-19, as the physical interaction with others can cause the virus to spread easily. Meanwhile, the moral hazard that leads to breach of the SOP by the government law, such as not wearing a mask in public areas, can cause the spread of the virus, as the mask is an important tool to protect yourself and others from the virus COVID-19. Therefore, the loss of the COVID-19 outbreak to the students is school closure due to the spread of COVID-19 among students and teachers in school. The students cannot go to school anymore and need to stay at home for online learning. Then, skill lost because of the limit of communication with friends, as they cannot go to school and meet their friends like before and only stay at home without involving in communication, and thus lower their communication skills. The lack of technology, especially for low-income families, reduce their communication skills, as they not only cannot communicate with friends, but miss the learning from school.
Firstly, Step 1, identify existing and potential risk. During the pandemic, all university students continue their education online. Some students acknowledge that they learn new skills in electronic, informative and other learning software. Some do not have adequate IT equipment to attend all classes, and others cannot afford the extra cost of improving their IT resources. Therefore, the unavailable external resources can impact the student learning experience. Then, Step 2, evaluating potential risk. After identifying two existing and potential risks, COVID has affected businesses of all sizes and industries. And the institution must evaluate the risk based on the likelihood of loss and the loss's frequency and severity. Frequency is the number of losses and severity is their maximum size. Different levels of risk require different risk management techniques, so evaluating potential risk is crucial. The institution must also evaluate this risk's scope to fully understand the relationship between risks and other factors. Next, Step 3 is select and implement risk management program. During the pandemic, universities must close temporarily to avoid COVID-19 infections. Every student must attend online classes. Residential college students should keep their rooms clean and avoid physical confinement. Everyone at the university should be vaccinated. The university must spend on sanitation in each area to keep them clean. Then, for loss prevention. This program seeks to reduce the frequency or number of losses. Identify COVID-19 symptoms when a student appears sick and designate a room for them. University can monitor students' daily activities, whether they leave campus or not. Physically separate students and staff, not just by cleaning and disinfecting frequently touched surfaces. Please encourage sick people to self-isolate. The last step, Step 5, is evaluating, reviewing and controlling the risk management program. In this step, We can't control risk, but we can avoid it with these steps. We must ensure our technique fits current conditions. Then, the techniques must be maintained if daily use is okay, or we can add others to ensure program success. We must also renew or change our technique if it's no longer suitable to handle the risk, because we can't predict what will happen in the future.
In a nutshell, the outbreak of COVID-19 does give a huge impact towards our economy, and it influences our macroeconomics such as unemployment, exchange rate, the percentage of inflation, our GDP, and many more.